Hi everyone, I'm Dr. Barrett, and this video is intended for my patients exclusively. If you've had surgery by another surgeon, please make sure to follow up with that surgeon for particular details about your surgery. And if you're having a medical emergency, please dial 911 or go to the nearest emergency room. Congratulations, you just had a Brazilian butt lift, or you're about to get a Brazilian butt lift, and we put together this video for you to go over all of your post-op instructions, so take notes. One of the most important things to do after your procedure the same day is drink lots of fluids, Gatorade, water, soups, whatever it may be. If you get dehydrated after your procedure, which is very common, you might need IV fluids and have to get hospitalized. So make sure you start right away, stay ahead of it, and know when you're peeing on a regular basis that that is a good sign that you have enough fluids on board. It's important after your Brazilian butt lift to not sit on your buttocks for at least 2 weeks. Okay, you can also do this for longer than that, but the evidence hasn't really shown any benefit of avoiding pressure on your buttocks for after 2 weeks. Now, why that's important is those little fat cells, they have to develop blood supply. Okay, so we want to minimize the compression on that so those little blood vessels can start to develop and feed those brand new fat cells. So if you're in a situation where you have to sit on your butt, make sure that you alternate. You alternate and you move and you move and you move, okay? When you sleep, try to sleep either on your stomach or supported with a pillow underneath your thighs and your back so that there's no pressure on your buttocks. You can also sleep on your side if we didn't do any hip dip transfer, but if we did do some hip dip transfer, that might be a little more difficult. We also should have provided you with a BBL pillow to sit on at a desk. If you have to take a long airplane ride, make sure you get an aisle seat and get up very frequently to alleviate the pressure on your buttocks. It's actually very normal to have swelling extending down to the genital area if you had any liposuction on the upper body. This is normal for men to have scrotal swelling and normal for females to have significant bruising and vulvar swelling as well. You might also get bruising and swelling extending down into the legs, away from the actual liposuction sites. This is also very normal. The swelling can last easily up to 3 months to 6 months in certain areas. Don't expect your liposuction results to look good right away. For at least 2 weeks, it's going to actually look worse before it looks better. It's normal to feel slightly anxious or depressed the first week or two after your operation. Don't worry, this is a normal reaction to any surgery and gets better with time and support. You're going to experience a lot of drainage from your access sites. That is normal. Make sure you don't sleep on any fancy sheets tonight and put protective towels down before you go to bed so you don't ruin the bedding that you might have. It's normal for this fluid to look either clear or slightly bloody or even a tiny bit of blood. It generally subsides within 24 hours. Now for the buttocks, they're going to be bigger and different looking than what your final result's going to be. Remember, we have to overgraft the fat, so we expect to lose anywhere from 20 to 50% of that fat, so don't expect to see your final result in the mirror today. It can take up to 3 months for that fat to subside and you to get your final result. You can also take a shower 24 hours after your operation. You can get everything wet. I do not want you to take a bath, hot tub, swimming, or getting in a body of water like the ocean or a jacuzzi. That just basically invites bacteria in. The pressure of the water can cause an infection. Shower is okay. Standing water is not okay. Overall, you want to be very healthy after your operation. Meditation to help lower your stress, okay? Smokers, you can't smoke for at least 6 weeks. For alcohol, people that like to drink wine or drink beer, there's no alcohol consumption for the next 2 weeks. That's going to decrease your ability to respond to any infections. Now you gotta remember that little patch behind your ear. Take that off as soon as you get home, but don't rub your fingers on your eye after you do so. If you leave it on, you will get blurry vision. Not a big deal, just take it off when you're ready. I want you to take the antibiotics as soon as you get home. The Caflex, you take 1 pill 4 times a day, spaced out every 6 hours. Don't wake up in the middle of the night to take it, all right? Take 1 before you go to bed and 1 when you wake up until the bottle is empty. Now, if it's clindamycin, it's 1 pill 3 times a day until the bottle is empty. Remember, all the antibiotics need to be taken their full course. The only time I run into infections is when people don't take the full course of the antibiotics as prescribed, so make sure you do that. Next thing is the Colace. Take 1 pill twice a day until you have a bowel movement. Once you're done with that, you no longer need to take the Colace. All these medications can be taken on an empty stomach, so take them right away. So I want to talk to you about some products that you should be taking after your surgery. It's really important to help you heal and help manage your symptoms. The first one I love is CBD. Okay, I recommend this product, Wild Health CBD. You take a full dropper, put it underneath your tongue right when you get home, and a full dropper right before you go to bed. You can actually increase as needed. You will sleep like a baby, and it'll actually calm your anxiety and calm down your pain to a manageable level. Magnesium is a great supplement for three main reasons. First, it helps control the muscle spasms that you get can be experienced as pain after surgery. Second, it helps with constipation, helps keep you regular. And third, it helps you sleep at nighttime. The best way to take this is 2 of these capsules at nighttime right before you're about to go to bed. Arnica, this is a product we recommend. It has arnica and bromelain in it, so that helps the swelling go down naturally, and it helps the bruising. What else do you need to take? Well, there's a product I also recommend. It's called Heal Fast. It's a vitamin supplementation that's designed to help you heal right after the surgery so that your body has the necessary nutrients to heal. You need to take 5 of these twice a day. I know that's a lot, but you need all of these nutrients to heal and to detox your body from the anesthesia. The other product is Masszymes. It has a whole host of enzymes, digestive enzymes. You want to take 4 of these pills with every meal to help break down the food and help decrease your body's inflammation so that you heal faster. You can absorb the nutrients and it decreases inflammation in your body. This stuff has been proven to speed up your recovery. It is a must if you're going to have any surgery by me. Lastly, scar gel. Pick up the Skinuva scar gel. You want to use this on your incision twice a day. The reason why I like it's got silicone and a bunch of other fetal growth factors that help the incision heal. So right around 2 weeks, you can start to undergo adjuvant therapies such as Venus Legacy skin tightening treatment, which has pulsed electromagnetic fields. Make sure you ask about that. It's a series of 8 treatments. It feels wonderful, speeds up your healing, and optimizes your liposuction result. In addition to that, we also recommend lymphatic massage that can start at 2 weeks if you feel up to it. A lot of our patients swear by it, and it helps their swelling improve immediately. If you feel in the areas of a liposuction on the flanks, they might feel areas of knots and firmness. You want to massage those twice a day in circular motions. I tell people if you take a shower, hop in the shower, massage 3 times in the area just to let it settle in, and that will help those little knots from the liposuction resolve faster. We recommend that you get one of our post-op recovery kits. It has everything you can possibly imagine you'll need after surgery, including gauze, medical supplies in here, saline, hand sanitizer, sleep mask, earplugs, you name it. It is personally picked out by me so that you have everything you need to heal and recover and take care of your body after surgery. Liposuction garments are there for comfort, they're not necessary, and they won't impact your final result, okay? So at the end of the day, if your compression garment is absolutely killing you or causing blisters or causing a rash, take it off, okay? It is there for comfort and to help to control your swelling. It will not impact your final result. This is especially true if you've had a Brazilian butt lift. A Brazilian butt lift garment can sometimes cut into the corners of the buttocks, and you want to make sure that it fits properly. If it doesn't, just take it off. It's no big deal. There's no requirement to have compression for optimal final results. It just gets you there a little bit faster and helps you with comfort. I want to talk briefly about Steristrips. These are covering your incisions. If they fall off, no big deal. You want to replace it with a Band-Aid, all right? Now, sometimes your body swells with the Steristrip on it, and if that happens, it can form a blister, all right? And if that blister happens, that's okay. Leave it alone. You can put antibiotic ointment on it twice a day, and we will remove the Steristrip in the office. If you get an allergy, it develops a severe rash that's red and insanely itchy, okay? It happens on all the areas where you see this Steristrip. If that happens, remove all your Steristrips, wash with gentle soap and water, and take Benadryl and Claritin to help ease the symptoms. If you have any questions, give the office a call. We close your incisions in multiple layers. The deeper layers are using absorbable sutures to hold your wound together. Sometimes your body extrudes those and spits them out in a slight inflammatory reaction, and if that happens, it's not a big deal. It happens to about 20% of our patients. If you do see that happening, give us a call. We can take it out in the office, or if you feel comfortable, you can pull it gently with a pair of tweezers and trim it with beauty scissors so that it dives down below the skin incision, and then cover with antibiotic ointment for a few days or Steristrip. After a BBL procedure, you can walk around right away, and I encourage you to do so. That helps prevent blood clots collecting in your legs. You can walk around 3 times a day for the first 2 weeks, and I encourage you to do that. Don't walk more than a mile. And then after 2 weeks, you can actually resume normal activity and increase as your body tolerates. All right, don't get right back into it running a marathon, but use your body as a guide and slowly ramp your normal activities back up to where they used to be. The area of the buttocks will be tender, they will be firm, but they shouldn't be excessively red or warm or irritated, okay? If you're getting any purulent drainage out of your incisions from the Brazilian butt lift, please do give us a call and let us know right away. If you're having a fever over 101 degrees, give us a call. The body temperature varies anywhere from 97 to 99 degrees, that's normal, but once it goes over 101 degrees, that's a potential problem. Also, if you have any significant bleeding or purulent drainage from any of your incisions, let us know. A little bit of bleeding is okay, a little bit of clear fluid is totally normal from a liposuction procedure, that's okay. But if you're getting a lot of bleeding or swelling in the abdomen area, that could be a sign of a hematoma. Now I'm talking like grapefruit-sized swelling, okay, not talking about generalized swelling. If you haven't urinated in 12 hours after your surgery, you need to give us a call or call 911 or your nearest emergency room. If you are persistently nauseous, vomiting, and you can't keep anything down, you need to give us a call 911 or go to the nearest emergency room. Congratulations on your Brazilian butt lift. You did wonderful. Remember, there's going to be a lot of changes that your body's going to experience. Don't expect your final result right away. Follow the instructions in this post-operative video and you're going to do amazing. Be sure to tag us in your recovery process, #BarrettRecovery, so that other people can be inspired and learn from your journey.